So let's bring in Dr. Janette Nesheiwat, a Fox News contributor. Dr. Nesheiwat, it's so good to see you. We all need a little advice right now.
Hey, Alicia.
Not sure exactly what to do with this new information. We've got quite a bit here, actually. But what would you say to folks out there who are hearing about these antiviral pills? How much comfort should they take in this right now?
A lot of comfort, Alicia. You know, despite the number of cases that we see surging throughout the nation, we're actually still in a better place than we were at the beginning of this pandemic because we're looking at a different way of treating COVID. We now have two antiviral medications that have emergency use authorization by the FDA. Paxlovid and molnupiravir. Now, it's recommended to use Paxlovid because it does have a higher efficacy than molnupiravir by Merck. But if we don't have Paxlovid available, then we should go ahead and use the other antiviral med because it can still give you about 30 to 50% protection against death and hospitalization, whereas Paxlovid by Pfizer can give you up to 90% protection. What does that mean? You're less likely to be hospitalized. You're less likely to lose your life if you are able to start these antiviral pills ideally within 72 hours. Now, if you still take them maybe on day 4 or day 5, it could still be effective, but it's most effective if you take them within 72 hours. And this is really, it's a blessing, it's a miracle. It's just a matter of getting the supply. We need production, we need manufacturing of this medication. We need it now, and so that's the biggest issue that we're dealing with right now.
You talk about the supply for this pill, but it's also running up against the supply of these rapid tests that folks are having such a hard time getting. And then also now when we even go to a location to get tested, members of my family were told it'll be 3 to 5 days before they get a result. So let's just fast forward. If it's going to take a while for us to get results, and the faster we use these pills, the better, don't we have a problem on our hands here?
Yeah, you're absolutely right. We have such a shortage of testing. Fortunately, you can use what's called a rapid antigen test, which you usually get within 15 minutes to an hour. It's the PCR tests that take much, much longer because they are a little bit more accurate. But you know what, Alicia? Sometimes if a patient comes in and they have all the symptoms of COVID, severe fatigue, sore throat, body aches, chest pain, shortness of breath, and they're not quite at the point where they need to be hospitalized, and maybe you do a chest x-ray and you can see a pattern of COVID, sometimes we will prescribe it if they are high risk, and we may not have the test back. So we can use our clinical judgment, which is still something that can be very useful for most patients.
Okay, so let's move on to what folks are doing right now. There are a lot of people out there, if they haven't canceled or changed their plans, they're planning to be with friends and family the holidays, or they're traveling. What can folks do at this point in the most realistic terms to protect themselves?
That's a great question. Ideally, the best thing is, of course, to be vaccinated and have your booster. If you get that third dose, you double your protection against Omicron from about 35% up to about 76%, which is phenomenal. Now, you can still catch COVID, but you will have either no symptoms or very, very mild symptoms, which is exactly what I'm seeing in my patients that come in: fatigue, body aches, sore throat, that sort of thing. And they're able to go home and just, use supportive medications to get them to feel better. But that's the number one. Also, testing. Try to get tested, especially if you maybe haven't had a chance to get your booster. Testing can be very helpful so that you know if you have it or not, so that you're not spreading it to others. And then, of course, try to celebrate safely outdoors if possible, and then try to limit your gatherings to, no more than 10 to 15 people. Those are all the things you can do to celebrate the holidays safely with your loved ones.
Dr. Nesheiwat, you always bring a calming presence, especially in this pandemic. We appreciate it so much. Merry Christmas to you and your family.
I'm Steve Doocy.
I'm Brian Kilmeade.
And I'm Ainsley Earhart. And click here to subscribe to the Fox News YouTube page to catch our hottest interviews and most compelling analysis.